So when we think about developing a comprehensive care plan, there's a range of things that we need to consider. Obviously, the first aspect is that we're going to be providing patient-centered care. We need to think of the individual. How do we ensure that we're meeting their needs? And a key aspect of that is screening for risk. We can look at all of those things that are a potential risk for our patient based on their clinical and physical appearance. We can look at their assessment of our patients to identify key risk areas that we might need to focus on, or perhaps drill down into more to understand more appropriately. Our clinical assessment is the key starting point to do this. And so having strong clinical assessment skills is a real benefit to ensuring that we're actually providing the most appropriate care comprehensively for our patients. And then, of course, there's the development of the plan itself. So we need to have a good understanding of the theory behind the practice so we can actually ensure that we're addressing the risks in the most appropriate way using best practice. When we're delivering our comprehensive care, obviously it's good practice to use a comprehensive care plan, and most organisations will have a variation of this. Some will be very, very detailed, others will be a little bit more high level. And of course, depending on the facility that you work in, the needs and the acuity of your patients or your residents or your consumers, that will determine the type of comprehensive care plan that you would need to develop. We also need to think too about comprehensive care plans for those at end of life. So for those that are in palliative care or entering palliative care, we need to think about how we look after those patients when our focus is not treatment or cure, it's on the quality of life and on alleviating symptoms. So a different focus in relation to comprehensive care when we're thinking about end-of-life care.